here and will know your name. Please greet us. Good afternoon. If this is your first time here, type first time or just say hi. You're welcome to this live, like I said. My name is Dr. Chinedu Williams, also known as Dr. Chandus, across all my platforms. And today we are going to be talking about something very important, but often hardly addressed. We're going to be talking about postpartum depression in or among Nigerian women. And we have an interesting and distinguished guest with us. We'll come to our introduction later, but first of all, let's start with some interesting facts. I didn't realize I knew it was bad, but I didn't realize how bad it was till I saw some of the figures. Do you know that 1 in every 4 Nigerian women will experience depression in pregnancy? That's a rhetorical question. And over 70% of them never get help. Recently I've been speaking to groups of women about postpartum depression, and around these parts, whenever you talk about mental health, people think that you're talking about madness and crazy people. People do not want to hear anything about it, and there's so much stigma and silence about it, and we want to change that narrative. Most clinics, one of the recommendations by WHO now is that mental health screening should be added to what is checked for. When women are pregnant, they're screened for all sorts of conditions. But the recommendation is that mental health screening should be part of these tests. But interestingly, it is not done. It is not incorporated anywhere in Nigeria. And yet, this is something that affects a large number of women. It can affect breastfeeding, bonding with baby's development. We'll talk about all those things as we go on. And that's why we are having this conversation. Today, I'm honored to have Dr. Ogali. Before I will not spell do your name like other people. Dr. Ogali Cele. She's a psychiatrist, and I will read her bio shortly. But this webinar will benefit you whether you're a mother, you're a partner, you're a health worker, you are a friend. It's not just for the lay public. Even I myself hope to learn a lot of things because it's an area I am interested in. So let me read Dr. Ogale's bio. Dr. Ogali Cele is a psychiatrist at the Federal Neuropsychiatric Hospital, Benin City. For those of us that know Federal Psychiatric Hospital, 𝐷𝐢𝐤. If you are in the Edo State area, when they talk about 𝐷𝐢𝐤, you know what is associated with that. Our people are very, very interested. So she works at the Federal Neuropsychiatric Hospital, Benin. Her clinical interests include substance use disorders and maternal mental health. She's actively involved in patient care and psychoeducation, which is one of what we're doing today, with a strong commitment into improving mental health awareness and outcomes in the community. Thank you, Dr. Cele, for joining us. Dr. Ogali Cele and I have an interesting connection. So if you want to know the interesting connection, stay to the end of this video. Don't stay to the end, you will not hear. All right. So thank you, Dr. Ogali. We are honored to have you.
You're welcome.
All right. So this is a broad topic, and we'll see if we can pack it into an hour. It's almost impossible to do so, but we'll do our best to see if we can maximize it. So we'll start from what is postpartum depression. What exactly is postpartum depression, Dr. Cele? Good afternoon, Dr. Ogun. We can see you. Thank you for joining us. If you are, sorry to cut you, Dr. Cele. If you're joining us for the first time, say hi to us and type first time so that we'll recognize you and welcome you to this webinar. So sorry for interrupting you, Dr. Cele. So let's go back to what exactly is postpartum depression?
Okay, thank you for your question. So postpartum depression is a mood disorder that affects a woman after giving birth. So it affects the way she bonds with her baby. It presents with sadness, in other cases, low energy levels. So that's what postpartum depression is.
Okay. The next question I will ask you is, there's something that people people normally talk about post, and they talk about baby blues. When women have their baby, let me not go into, you are the expert. Let me just allow you. So there's a common term called baby blues. How is that different from postpartum depression? Like, what are the cardinal features? How can we tell that this is postpartum depression and this is baby blues?
Okay, so you're actually right. There's something called baby blues, and it's actually very common. About
Okay.
70 to 80% of women have baby blues. But how can we differentiate this now from postpartum depression? So, for baby blues, it occurs a few days after a woman gives birth,
Okay.
and it resolves within 2 weeks. You understand? And it's not as
Okay.
intense and severe as postpartum depression. For baby blues, the woman may present with excessive crying, irritability, but she's
Okay.
still able to function. She's still able to take care of her baby. But in
Okay.
postpartum depression, the woman may not be able to function or even take care of her baby. So
Okay.
it is, and it resolves without any form of treatment, unlike
Okay.
postpartum depression, where you may have to treat this patient.
Okay. So let me now ask a question, because you are in practice, you're actively
Yeah.
in practice. How common are these two disorders? When you talk about, I've had, because in the last couple of days and weeks, I've been doing a lot of posts about postpartum depression, and the messages I've been getting, they are mind blowing. Like, you will not realize that women are actually going through these things.
Yeah.
So I want to ask you, even though I've talked about the statistic, like, how common is it? Does it happen? How does it usually present? Even though we're going to talk about signs and symptoms, but typically, how do they present?
Okay, so yes, they are very common. Like for the postpartum depression now, the percentages are between 10 to 25%, even higher. You
Hmm.
understand? For the baby blues, 70 to 80%, but you will not really see women with,
70 to 80%.
yes, it's that
That,
high.
that's a
Yes.
lot.
Yes, but you won't typically see women with baby blues in the clinic because, like I said, it resolves after a few weeks, and it's not as severe as postpartum depression. You
Mm,
understand? But even
mm.
in some parts of the country, like the northern parts, they have figures as high as 45%. So it's that common, and because of our culture, people don't talk about it. Giving birth to a baby is a thing of joy. So to now
Yeah,
come out and say, oh, I'm feeling sad, I'm not happy about it, I can't even take care of my
yeah.
baby, people will look at you like, is this one okay, or is this some form of spiritual attack? So because of the stigma associated with this condition, people do not really come out to talk about it.
Okay, let me ask something before we talk about signs and symptoms. For especially for first time parents, it is normal to have, a bit of overwhelm. I don't know
Yeah.
if you understand what I mean.
Yes,
Like,
I
oh,
do.
I've had a baby. Do I know what I'm doing? How do you, like, it just feels like there's a thin line between overwhelm, baby blues, postpartum. Even though postpartum depression is an actual pathology, but is there any way to differentiate this thing line? Because at the end of the day, we want people to be able to identify, to know which is which, you know. So where does
Oh,
that line, where is
nine.
the line?
Oh, okay. Yeah. So, like I said, now for the baby blues, it occurs a few days after a woman puts to birth,
Okay.
and she may present with feelings of excessive crying. Oh, she's irritable. She doesn't really have the energy level to take care of her baby and do her normal activity. But it resolves without doing anything. You just notice that, oh, one day your mood has improved. You are able
Mm,
to, and you are able to function. It
mm,
doesn't affect your ability to function. So you can take
mm,
care of your baby, breastfeed,
mm.
also take care of yourself. But in postpartum depression. Now, it comes with persistent sadness that has lasted more than 2 weeks. You understand? So this woman is persistently sad. Then she has low energy levels. For some people, they even have suicidal ideations, like they may want to harm themselves or even harm their baby, and it affects their function. So they are not able to take care of the baby. They are not able to do anything. In fact, I had a patient once that had postpartum depression, and when she came with the baby, she kept telling me, "Is my baby okay? Am I fine? Oh, I don't think I'm doing enough. Oh, I don't think this." She just kept going on how she was not sufficient enough for this baby. So they present with feelings of guilt that maybe they are not good mothers. They feel hopeless, like there's no hope. Their sleep is affected, and it's not just the sleep that when you have a baby, sometimes
Yeah.
you are not able to sleep. It's not that.
Yeah.
Even when the baby is asleep, they can't sleep. Then for some of them, they have loss of appetite. Some people overeat. So you see all these symptoms coming in postpartum depression, and it doesn't get any better. You understand? So that's how you differentiate. So it continues. So eventually the woman will need treatment. Unlike baby blues, that after a while it just lives by itself after a few weeks.
Okay, thank you for that. If you're just joining us, Dr. Ogali Cele, we have been having a conversation with Dr. Ogali Cele, a psychiatrist with the Neuropsychiatric Hospital, 𝐓𝐡𝐚𝐭, Benin City. She has just told us what postpartum depression is. She has also just told us the difference between postpartum depression and baby blues. So even though it feels like I am repeating my questions, I'm going to ask, what symptoms should mothers, partners, health workers watch out for, right? What should raise an alarm? I know it sounds like a repetition, but what should people be looking out for? And then jumping on that, what does it typically look like in Nigerian mothers? Because remember, we're in a unique setting,
Yeah.
right? We are religious people, we are
Yeah.
cultural people, and all that. So I know it's like a two-in-one question, but
Okay, so the symptoms of postpartum depression are: the woman presents with persistent sadness, low energy levels. So she's not able to do anything. Some people will term that as, oh, she's being lazy. You understand?
ole.
Yes. So things that will usually interest her, she has no interest in pleasurable activities. For example, maybe she was someone that loved listening to music. Now, music gives her no joy. Then there's this feeling of guilt, feeling of hopelessness, poor sleep, not being able to sleep, not being able to eat. So there's poor appetite. For some people, there's overeating. Then the mother is not able to concentrate. Then there may be some ideas of suicide. So the mother may want to harm herself or even harm her
Okay,
baby. So these
we
are
have to be
some.
careful. We have to be careful with the language, because of YouTube restriction. But
Yes,
so far, so
yes,
good. It's a health education. I want to believe they will understand. But please continue.
yes. Yeah, so these are some of the symptoms a
Okay.
mother will present with. Now, coming to our own setting, the mother may present with headaches, body
Okay.
pains, poor sleep. We actually refer to them as somatic symptoms. So we see more of those complaints, like
Somatization.
the typical "I'm sad," because when you ask a Nigerian, "Are you sad?" they will tell you no, they are not sad. So you may not have that oh, I've been persistently sad. It's maybe family members that may now give you that history that, oh, they have
Yeah.
noticed that her mood has been low recently. You
Mm.
understand? So those are some of the symptoms. So more of somatic symptoms: headache, not being able to sleep, body pains, like crawling sensation on the head, movement around the body. So those are some of the symptoms that a mother may present with in our own setting.
Quite interesting. Um, if Can it happen? Just riding on that too. even if a woman has had a normal birth and a healthy delivery, can this still happen? Like, does it have any relationship with mode of delivery and birth, childbirth, pregnancy events, and all that?
Okay, there are some studies that say postpartum depression is higher in women that have had cesarean sections.
Okay.
However, even if you had a normal birth, you can still have postpartum depression, because sometimes it may even be caused by an hormonal change. You understand? And hormonal changes happen in both, whether a normal delivery
Yeah.
or a cesarean section. So it can happen even if a woman has had a normal delivery and the baby is well and healthy.
Okay. So if you're just joining us, welcome. People have been joining and leaving and joining. But if you have ever heard of postpartum depression before, please reply with a yes or a no. Have you ever heard of postpartum depression? If yes, please type yes. If no, please type no, so that we'll know that we'll recognize those of us that are here. So I know this is an out of the box, spur of the moment question. Are there, oh, Dr. Age, thank you for joining us. You're welcome to this live. Thank you for joining us. So, are there risk factors? I know this is an out of the box question. Are there factors that make some women more likely to get postpartum depression than others?
Yes, there are factors. So, like
Okay.
I said, hormonal changes.
Yeah.
Then, for a woman that has had a past depressive illness, is
Okay.
most likely to get postpartum depression. Even women that have other mental illnesses. Then,
Okay.
if there's a family history of
Okay. Mental
depression,
health disorder.
yes, yes, there is a likelihood of having postpartum depression. Then also stressful conditions. Maybe the woman does not have support during
Okay.
the before she gives birth and
Mm,
post after she gives birth. So those are
mm.
some of the factors that can actually lead to postpartum depression.
Okay, very interesting and relatable. I also saw, maybe just to add, financial. Is there a relationship between financial? That's some form of support too,
Yeah,
especially
yeah.
in this environment. Um,
Environment, yes.
yes, financial lack of financial support, especially in this environment. Okay, um, so let's move on to talk about, if we have any questions, by the way, please feel free to drop them in the chat for our distinguished guests, and we'll take the questions. We're adopting a question and answer pattern so that we can get to what exactly we want. Because remember, we said postpartum depression. What is it? How to identify it? When and how to seek help. So let us move to ask, when should a woman seek help? Like, what are the red flags? When should a woman know that, this one, no, I need to see somebody. I need to do something.
Okay, so when there has been persistent sadness for more
Okay.
than 2 weeks, when the woman's function is being affected, she can't take care of her baby, she can't take care of herself, she has thoughts of harming herself or even her baby. You
Okay.
understand? So
Mm,
these are some red flags that, oh, it's time to seek help.
okay. Okay. I want to ask another interesting question. I say interesting because of the relationship healthcare in Nigeria. Relationship healthcare in Nigeria has with religion and tradition, right? Because of the this iceberg phenomenon. Because most of the cases are, maybe I'm preempting your answer, because most of the cases we see are the tip of the iceberg, the buried, the tip of the iceberg. Most of the cases are submerged. So my question is, um, where can women go for help in Nigeria? If I need to know this myself because of my advocacy and my health education that I am currently doing, some of the work that I'm doing. So where I know abroad they have support groups, this one, that, but we are in
Yeah.
Nigeria. So where can we get or where can such women get the correct help that they need?
Okay, so as a psychiatrist, I will say come to a psychiatric hospital. But I know there's a lot of stigma surrounding coming to a psychiatric. If I want to just mention psychiatric hospital, wow, it's as if, but that's where you have um, the mental health professionals that can actually treat this illness. Then the general hospitals, there are some departments that have the mental health department. So you can also get treatment from general hospitals. The
Okay.
primary health care so far, well, they may not
It's a
have a
work in
special.
progress.
Yes, yes. So it's a work in progress. So I would say the psychiatric hospitals, the general hospitals, and please, we should, even though there is a stigma associated, we should still try and come to these hospitals because that's where you are going to get professional help.
Okay, so they should not go to church. They should not tell their pastor. They should not tell their igwe. You know, they should not
No,
do
no,
those
no.
things.
No, you can actually tell your pastor because support
Mm,
also helps in treatment. So
yeah.
imagine you have support groups in church, people are praying for you. People, in fact, let me share a story. I had a patient once, and what led to her illness was she gave birth and she had no support. She had no family, and the husband didn't really understand. You understand? So she had to cook, she had to clean. So it was a lot for her. So it was her pastor's wife that was coming from time to time to help out. So the churches have a role to play. You understand? So we won't say, oh no, don't tell anybody in church. No, they can actually offer support.
Okay. So there's a role. They have a role to play,
Yes, they
right?
have a role. Yes.
Okay, so what if you're just joining us, we still have Dr. Ogali Cele with us, and we have just asked her when should a woman seek help for postpartum depression, right? There's something I read that says there's a contribution that believing in something greater than you has. I don't know if you understand what I'm saying. If you believe in a supreme being, like those of us that are Christians, we believe in God, we believe in Jesus Christ, that there's a role that also plays. I don't know what you think about, even though it's what you have said. If you believe that if you're a Christian, for instance, and you believe in Jesus Christ, if you believe that he can help you, just the belief in something supreme, bigger than you, that it also has a role to play. And also, me and public health. eh, there's a mix beyond looking at it the other way. There's a role that they have to play too. The churches, traditional rulers, if we have them saying, oh, mental health disorders should be talked about more. There is help. This is where you can get help. This is how you can get help. They also have an important. We call them gatekeepers. They're also
Mhm.
gatekeepers. Okay, because if you have a traditional ruler saying or a pastor saying, postpartum depression, there's actually something like that. You can get help. We will pray, but this is what you can. At this point, I think you need especially in a society like ours that is very religious focused, very traditional, very cultural, and all that. I quite agree with you that there's a role for for our pastors, for our imams, for our spiritual leaders and our traditional rulers. So let me ask then. Okay, thank you, Ada, for that comment. Ada says in the comment, indeed, churches have a role to play. Thank you for bringing light to this very important topic. Ada, thank you for joining us. We appreciate your comment. So we're still encouraging us to, in no time, we'll be rounding up. We're not going to take so long. We're looking at 45 minutes as it is. Please leave questions for our mental health physician or psychiatrist. Please leave a comment for her in a question or your comments or your thoughts for her in the comment section. All right, so let me now ask, what does treatment for postpartum depression involve? Because when you hear treatment for mental health disorder, people imagine all sorts of things. Hey, they will tie them rope. Hey, they will flog them. Because that's what they do in some of these funny places that they take people to. Because that's the first reaction when people have a mental health disorder in this environment. They tie them up, lock them in one room, and they start flogging them, or they take them to one funny place. So what does it involve? What does treatment involve?
Okay, so the mother is assessed because there are different types of treatment. Now,
Okay.
for some people, they may undergo what we call psychotherapy. So it's just basically like a talk therapy. You understand? So they may undergo psychotherapy. For some others, it may be medications. Medications we call antidepressants. You
Okay.
understand? Then it
Mm.
could be a combination of psychotherapy and medications. That's the antidepressants. Then we could also involve support for
Okay.
this patient. Yes, because if we find out that okay, this patient needs some form of support, we may call the family members, discuss with them, and see how the patient can be receive some form of support. So that's what treatment entails. It's not just all medications. You just come, I just give you
Okay.
antidepressants, and that's all.
Okay, so not everybody will take drugs, right?
No,
Okay.
depending on how severe the illness is.
Okay. So does presenting early have any role?
Yes, yes. Because if you present early, the outcome is usually good. You
Okay.
understand? Because by the time you delay, it becomes more difficult to treat. But
Okay.
presenting early comes with a good prognosis.
Okay. All right. So if you are just joining us, we have just talked about, I've just asked our psychiatrist what treatment for postpartum depression involves. And she has just told us not everybody will get drugs. So don't run away and don't feel like, oh, your friend or your sister or someone that had postpartum depression was giving drugs. I don't want drugs. I will not go. No, because like I said, or like we've been discussing, postpartum depression affects not just the mother, it affects the baby. Remember when the psychiatrist was talking, she said, it makes the mother have lack of interest in not just herself, her baby, right? So in some cases, you may begin to see things like not low baby, but malnutrition. You understand? Because the mother will not care whether there's a child there. She's battling with herself, with her emotions, with her symptoms. And mind you, some of these symptoms are confusing. You understand? Many of these symptoms are confusing. She does not understand what is going on with her. She's just in a world of her own balloon. And then you are telling her about baby. So most times they are not interested, they are not interested in the baby. Remember, the psychiatrist has also told us that there's something I also read that not every mother will bond with their baby immediately they are born. So let's not mix it up. Let's not say, oh, when I gave birth to my baby, I was not interested. I don't even know whether there's baby there. No. Over time, there are some things that take time to develop, right? It doesn't mean that woman has a psychiatric disorder. That one size does not always fit all. When I've learned that for most of these things. So let me not rant so much. Let me ask, can a breastfeeding mother, because that is the concern for a lot of women, can a breastfeeding mother still take these drugs? Can a breastfeeding
Yeah.
mother be treated for postpartum depression?
Yes, so a breastfeeding mother can actually take these drugs. So a little percent of these drugs are excreted in breast milk, just a little percent. And this percent is not even harmful to the baby. So a breastfeeding mother can actually take this medication. And you know that at the end of the day, we want this mother to be well so that she can be able to take care of her baby.
All right, sorry. So you will hear my daughter in the background trying to come in. It's part of Sunday life. Okay, so she has just told us that we do what is called a cost benefit analysis, so to speak. So you weigh the benefits as against the side effects, and is a small amount of these drugs that get into breast milk anyway, which does not necessarily harm the baby. So treatments can continue. So do not be afraid if you are a mom in this situation. I want to tell you once again that you are not alone. There's treatment available, there's help available, and that you can actually get on medication despite or in spite of your worries. So let me now ask, how can a husband or a family member, or quote unquote, the village of a woman, when I say village, not her village, her support system, how can they support a woman going through postpartum depression?
Okay, so the first thing is, don't judge this woman. This is an illness. She didn't bring it upon herself. So
Yeah.
don't judge her. Then help her, assist in any way, like taking care of the baby, doing house chores. Encourage her. You understand? Don't go and start telling her, look at other women. They gave birth
Mm,
to 5 children. They didn't have such
mm,
illnesses. So encourage her. Tell her that this is something she can get through. You understand? Encourage her
mm.
to even open up about the symptoms she's feeling. So these are ways a husband, the relative, or even her support system can help and encourage her.
That's fantastic. I want to just, well, not really add to that. I just want to say something now, or a question. Could it be that some of these comments, because the next question I want to ask you is, what is the worst thing that a partner can say or do to their spouse that has postpartum depression? Could it perhaps be due to ignorance? I know that some people can be mean, some partners can be mean, but perhaps it is still the same ignorance and lack of education. People don't know anything about it. Could it be that too? Maybe I'm asking two questions in one, but I know you get what I mean. What's the worst thing? Like, what should a partner not say or do at all to a woman who is in this position?
Okay, so I will agree that it's ignorance, because
Mm,
postpartum depression is a medical illness. And like
mm,
any other illness, it's not something that you just say you want to have. You
mm,
understand? So our people sometimes do not understand that these are medical conditions. So you hear a
mm,
partner saying that you are just lazy. You
Or that you
understand?
are mad.
Yeah. Or we tell you that, are you not seeing other women? In fact, someone will say, I had 5 children. So why are you not able to take care of your own baby? You understand? So these are some of the
Or
things we
that you
can
are
actually.
malingering, you are pretending.
Yeah, you're just
Just want to
pretending.
stress everybody.
Yeah, you don't want to do any work.
Mm. So we have heard it, partners on the call, mothers on the call. We have just heard some of the worst things that a partner can say or do. Another worst thing that a partner can do is to abandon their spouse.
Yeah.
That's the worst thing that you can do, to abandon your spouse when they most need you at that time, because it's a critical period. The woman cannot understand. And we forget that there are extreme cases where you now have suicidality. That woman needs help. You understand? At that point, she may not be able to help herself. So that is the worst thing that you can do to a partner. So let me, what difference, let me ask, Thank you for the super chat, Mutolani 𝐼𝐤𝐥. That's our first super chat on this channel. So thank you. We celebrate you, Dr. Cele. They are hailing you. That well done.
Thank you so much.
Please, if you're enjoying this conversation, I'm enjoying myself. I'm learning a lot. If you're enjoying this conversation, please type yes. Let's know that we are not alone, or we are not singing, we're not singing into an empty space. Just let us know you are here by saying, yes, this is insightful or something. Just greet us, say something to us. Okay, so let me ask, Dr. Cele has told us quite a lot already. She has told us what postpartum depression is. She has told us how to identify the red flags. She has told us what treatment involves. She has told us when to seek help. She has told us about support. We have just finished talking about support. I am going to ask the last question with regards to support. Thank you. I see all the yeses in the comments. Well done. Please also give us some emojis. Let's see plenty emojis. Let's see emojis appreciating Dr. Cele. So what's difference now? The next question is, what difference does emotional and practical support make? Thank you, Ada.
Okay,
Thank
so
you, NMA Rivers, Dr. Ogun.
it makes recovery faster. You
Okay.
understand? Because the mother is more open to tell
Mm,
you what she's experiencing and is willing to even
mm,
seek treatment. You know, when
mm,
you condemn a mother or a patient passing through postpartum depression, they tend to hide. They don't want
mm.
anybody to know that this is what
Yeah.
they are going through. They try to
Mm,
handle it alone. But when you
yeah.
encourage them, you support them, they are now open to you. They can tell you, oh, this is how I feel, this is what I'm going through. And it's easier for them to seek treatment and even get better with all the support.
Sorry about that. I stepped out for a minute just to share the link because some people were complaining. We had a bit of difficulty in the beginning with the setup. So, hi, Chinyere Pamela Bonnie. Thank you for joining us. I don't know how long you've been here, but we hope it has been insightful for you. We have been talking about postpartum depression, and we're starting to wind down. It's been an interesting Sunday. In fact, I've had a very long Sunday. I don't know about Dr. Cele, but I just hopped out of church barely an hour ago. But so far, I think I've been enjoying myself. I've learned so much already. In fact, I wish that the session will not stop. But I want to emphasize once again that help is available, recovery is available. Let me now ask a question. I want to ask a question. Um, is there hope? Like, is there after postpartum, what is life like after postpartum delivery and postpartum depression? Sorry. Like, what is the prognosis, if you know what I mean? What's the prognosis for a woman that has postpartum depression? Right? I don't know if you understand, if you see where I'm
Yeah.
going. Mm. Are there
Yeah.
women that after postpartum depression they go into full-blown mental health disorder? Do they get better? Like timelines, when do they expect to be better? That kind of thing. Thank
Yes.
you,
So
Mutolani, for the super chat. This is fantastic. Please keep it coming. Our target is 5 super chats. If we can get 5 super chats, we'll get another professional. I'm sure you're enjoying this interaction today. When you have people that know what they are doing speak about a subject, it becomes interesting. I believe that I always say that healthcare professionals should be on this space. People who actually know what they are doing to tell us the correct information. I started my YouTube channel to make sure that misinformation is reduced to the barest minimum. So I'm happy to see that we are enjoying the session with Dr. Kale. I'm enjoying myself. So, Dr. Cele, what is prognosis like, and what is the outcome in terms of outcome for these women?
okay, so during the discussion, I talked about presenting early.
Okay.
So once a mother presents early, that's a good prognosis.
Okay.
But if this illness is not treated, it becomes more difficult to treat it, and it could now lead to depression, a full-blown depression.
Oh,
Yes.
oh.
So most
So
mothers
so
that,
such a mother becomes full-blown depression for life.
yes, yes,
Mm.
yes. So if a mother presents early and takes the treatment, she can go on to live a normal life. The prognosis is very good. That's why we need to talk more about this and get women to present to the hospital for treatment. And now that the woman even has it, we try to prevent it for subsequent pregnancies. Because when I was talking
Okay.
about risk factors, I also
Mm.
talked about
So it
um,
recurs, right?
yes,
It
it can
recurs.
recur.
It can
So you also,
recur.
yeah, so you also want to prevent it for other pregnancies. You understand? So
Okay. So
the
what is it?
key here,
Sorry to cut you. Sorry to cut you. I'm
okay.
sorry. What is the management like for such a mother in the subsequent pregnancies? Is it that does she continue to take, like in pregnancy? Does she take her drugs and not, like how? Because some mothers will be worried about the safety of those drugs in pregnancy. Because these are the things that make some people not want to come forward.
Yes, so she will be on her medications while we monitor her, monitor for any symptoms while she's on medications, and she can actually safely take the medications while pregnant. Even something I failed to mention, there are some people that even present with depression while they are pregnant. So their own
Yes.
depression even starts before
Yes.
the
Let me let
postnatal.
me let me say something about that. I saw a study that said that many of these cases that occur postpartum started in the antenatal period and they were not
Period.
detected. And that is why some bodies are advocating for mental health screening in the antenatal period. It's
Yeah.
something I'm doing some work with regards to that, and that's why I'm very excited about this topic. And in the work I'm doing, I have seen quite a number. In fact, from just the preliminary results, I'm seeing antepartum antenatal depression already. The what's it called? The screening tools. From the screening tools, I'm already seeing persons that are already flagged for antenatal depression. So it means that you're
Yeah.
going to look out for those women in the postpartum period. So this is
Yes.
quite interesting. Sorry to interrupt you. Please go ahead.
I think I've answered your question.
Yes, doctor, she has actually answered our question. So she has said such women can safely get medication in pregnancy. They can safely monitored, and
Yeah.
they can live a normal life. Like coming forward for treatment does not mean you will be labeled or there's no hope for you or there's no recovery. Life can and does go on, and the people you're thinking will stigmatize you are probably going through the same thing.
That's
They
true.
are probably going through the same thing, right? So, Daughter of Yahweh, thank you for joining us. Thank you for saying hi and letting us know you are here. We are happy to have you. So I think Dr. Cele has answered that question. I don't know if there's anyone, because I have not seen any questions in the chat. Is either we have not learned anything or the lecture is very, very, or the, the interaction is very clear. So are there any questions for Dr. Cele as we're winding down to close? We've been here for about 54 minutes, close to an hour. Time does fly. So in the 54 minutes we've been here, we have talked about what postpartum depression is. We have talked about the signs and symptoms. We have talked about when to seek help. We have talked about where to seek help. We even talked about the interaction between healthcare, mental health care, and religion and culture and everything. We also talked about the role of partners, our daddies, our grandmas, our health workers, right? Even us as health workers, those of us that are not psychiatrists, we also need to be open because I know there are quite a lot of health workers on this call. We also need to be looking out for these, these cases. They are there. Because if you don't look for something, you will not find it. Even myself of recent, because of all these things I've been doing, I've been looking, and if you look out for, you will find, you will see. I have personally seen quite a few. So please, if you're a health worker on this call, look out for women who are in this category, especially as you know where to give them, to get help for them, right? So please look out for them. Be open to them. This is for health workers now. Be open. Do not be judgmental, right? Do not be dismissive, right? Because we're on this call encouraging our women to be open, to come forward. So when they come forward, please receive them and guide them and direct them right. Okay, thank you, Dr. 𝐷𝐿, for joining. Dr. 𝐷𝐿 says, well done, Doc. This is very interesting. Is there any program for this category of people? I don't know if Dr. Ogali, do you know? Is there any
Well,
formal? I know there's a Mental Health Act, right, that has
yes,
a framework and everything. But we know how
yes,
acts go. We know how
yeah.
policies go in Nigeria. So are you aware of any like NGO? Maybe I should have asked you before now. Maybe I should have asked you, but are you aware of any NGO or bodies that are doing work? I saw on Instagram, in fact, it's the first postpartum, at least to my knowledge, please correct me in the comments if I'm wrong, is the first postpartum care clinic in Nigeria. They launched it recently in Abuja. I saw it and I was so, in fact, I was happier than happy. I was so excited. So that clinic specifically, that is what it is for. And I think I would like to, if it's just that Abuja is far and all that, but then it's good that we're seeing such things. It means people are thinking and people know that this is a problem that needs to be addressed. So, Dr. Ogali, sorry that I'm talking plenty. Do you know of
There's
any?
no problem. So, well, I don't know of any programs for now, but what I know is psychiatrists have been trying to integrate mental health into the primary health care system. So we've
Okay.
been going over this because because most of our population will go to primary health care
Yes,
before they even go to,
that's where you catch most of
yes,
them anyway. Yeah.
yes. So we have been trying to see how we can get mental health professionals in those primary health care centers, or even train some of the staff to be able
Mm-hmm.
to identify
Exactly.
mental illnesses and refer to the appropriate quarters. So,
Yeah.
but I don't know of any program that really addresses postpartum depression.
Wow, this is well. There's so much work to be done. So
Yeah,
much. Well,
a lot of work.
this is one of such steps in the right direction. We keep talking about things like, I know people say, when we talk and talk and talk, what does it achieve? Yeah, it does achieve something.
You're
If we
not.
keep in our small corner, we keep pushing for this and talking about things like this, one day we will get it right. We'll get it right. So I don't see any questions, and I don't want to hold Dr. Ogali longer. I want to ask her to give us one final takeaway. If you could leave us with something, what's one final takeaway? What would you want
Okay. So,
everybody? Oh, we have a comment. So we have a contribution. Dr. Modu, thank you for joining us. Sometimes these women may
yeah.
not know even their spouses. It is therefore very important for us to be open-minded, identify and
Yeah.
encourage them to access care. This is in line with what we were discussing earlier on, that health workers, we should be open. We should keep our eyes open, and we should also be open. We should not judge them. We should not dismiss them. We should welcome them and guide them appropriately, because you you'll be surprised how people trivialize that woman. Not be other woman, they always come here every time. I beg you, she gets small. Just leave her. Just like I've been in settings where these
Yeah.
things happen. I don't want to say the cadre of setup where I've seen this happen a lot. Some of these cases still ring, they are still in my memory. So yes, I agree with you. Thank you for that contribution, Dr. Modu. So Dr. Gali, if you could give us one final takeaway, what would it be?
So I would like to say that postpartum depression is a medical illness that requires treatment. So we should not stigmatize this set of people. We should not make them feel like they have a problem. And in our own setting, where we may say it's a spiritual attack or it's some form of witchcraft. No, it's just a medical condition that can be treated. Thank you.
Okay, thank you for that. You see, she says mental health disorders are medical conditions that need treatment and they should not be stigmatized. The treatment for mental health condition is not stigma. It's not stigma. There's treatment and it's available and it works. So someone is asking again, Motolani Akimbo, she says, what should the women eat to prevent depression? Anything.
Okay. I don't think depression is related to the food you eat. It's
Okay.
it's, it's not related, yes. It has nothing
Okay.
to do with what you eat.
Okay. Unfortunately, the psychiatrist said there's nothing we can eat to prevent depression, but unless if you are privy to some information, there are studies coming out every day. If you are privy to some information, please share with us. We are happy to hear and to critique and to argue. Okay, thank you for that question. I want to thank us. My takeaway is still right. My final takeaway is riding on what Dr. Ogale said. Help is available. Help is available. Recovery is possible. And if you are in this category, you are not alone. You are not alone. So if you are watching this video, if you are watching the replay of this video, please share it. Like, you will agree with me that this is an important and a much overlooked but important topic. So if you are watching this video after we have done the live video, please share it with as many mommies, as many daddies, as many health workers, share it with your 𝐷𝐷𝐽 if you believe it will help one person. I want to
Yeah.
thank all of us for joining us today. It has been 1 hour of interesting conversation, of learning. I want to thank Dr. Ogali Cele. I told us that I will tell us the interesting link we have. Dr. Ogali was my roommate in medical school, and I've not seen her for quite a long time, at least not video call. So I'm excited to see her. That's why you see, conversation flows really well because we had quite a lot, we were in the same room, so we used to talk and gist a lot. So it just feels like two friends chatting. So I want to tell you, if you are just coming across this channel, please follow me. Subscribe to my channel if you learned something. Dr. Gale, is your YouTube active, Dr. Gale?
It's not active, but
She's
I will
not, so we can.
activate it now.
Okay, I would have said, please follow Dr. Ogali. You don't lose anything from following a professional so that you can get the correct information. But you can follow her on Instagram. She's on
Yeah,
Instagram
on
as Ogali
Instagram.
Ogene
Ovary seller.
Ovary Cele.
Gali Ovary seller here.
Okay, I wish I could type, but I don't know how to navigate this platform. But you can follow me. My name is Dr. Chandus on Instagram, on Facebook, on TikTok, on all platforms. I create content that empowers mothers to make informed health decisions about their health and about the health of their babies. My goal is that misinformation will go down and our women will be empowered to take decisions for themselves and for their babies. So I want to thank you again, Dr. Ogade, for your time. I want to thank you,
Welcome.
amazing viewers, for staying this long. God bless you. Please, if you would like to see another interesting conversation like this, we would like to see Dr. Ogale some other time, but in fact, Dr. Ogale is busy. It was hard to get her to come on this live. I know how many begging. In fact, when she said, can we do it on Sunday, I did not even ask. So that was her church harvest. I did not even ask. I said, please, let's just do it. So I want to thank her for sparing the time. So if you want to
Yeah,
see more like this, please, let's see emojis. We want to see her on this channel so that I can beg her and squeeze her to come for another topic again. Let's have emojis and yeses and thank her for coming. So thank you so much once again. Let me not take so much of our time. You see, Ogali, they say you should come. Are you not seeing the
Don't
love?
worry, I'll be back. I'll be
Come
back.
to my channel and educate our mothers.
I'll be back.
Thank you so much. All right. Good evening, everyone, and enjoy your Sunday. Thank you, Dr. Ogali. Thank you,
You're
CNA.
welcome.
Thank you, NMA Rivers. Thank you, Dr. Modu. Thank you, Dr. Age. Thank you, all my people. Thank you, Dr. Ajoku. You see, everybody saying yes. You better come back. I'll go and think of, maybe we'll do postpartum anxiety. Because let me ask, there's postpartum anxiety, but
Yes.
okay, and I
It's
know they are related.
they are
It's
related.
like
Yes.
a, yes. Okay. Thank you, 𝐿𝐷𝐻𝐵𝐻 Pamela, for joining us. Everybody's saying you should join. Everybody's thanking you and thanking you. Okay. We have to go. Let's allow Dr. Cele to go. God bless you and see you in the next video. Bye.
Thank you.
Thank
Bye.
you. Bye.